Today we are going to talk about the crossbite. So before diving into the full details of the crossbite, we need to have a very good understanding of the normal relationship of the anterior and posterior teeth. Normal relationship, the upper teeth are labial and buccal to the lower teeth. So the deviation from this normal relationship is considered as the crossbite. So diving into the definition of the crossbite is in fact the discrepancy of the buccal-lingual relationship of the upper and lower teeth, and by convention the transverse relation of the arch is described in terms of the position of the lower teeth. In the British system of the classification, they considered the lower arch as the reference arch for the classification of the crossbite. However, the Americans take the upper arch as the reference arch. Moving on, if in the coming presentation we will be considering the British system of the classification. In this classification, you will be observing here the crossbite. As we have defined, the crossbite is in fact the discrepancy in the transverse relationship of the anterior or posterior teeth. So here you can see the abnormality in the position of the upper posterior teeth, because this is your reference of the normality. This is the normal relationship in which the buccal cusp of the upper teeth are buccal to the buccal cusp of the lower teeth, and there you can see the discrepancy. Here, the buccal cusp of the upper teeth are palatal to the buccal cusp of the lower teeth. So this we describe as the buccal crossbite. There is a discrepancy and the disturbance in the in from the normal relationship of the teeth we describe as a crossbite. There is another variation of the crossbite that we call as the lingual crossbite. Here also you can observe the discrepancy in the transliterations of the teeth. So moving on to the buccal crossbite. Buccal crossbite is in fact a kind of a situation in which the buccal cusp of the lower teeth are buccal to the buccal cusp of the upper teeth. As I said in the start, in this presentation we will consider the British system for doing the classification of the crossbite. So this is the buccal crossbite. If I say simply, the lower teeth are buccal relative to the upper teeth. And in terms of the cuspal relationship, we can see another way that the buccal cusp of the lower teeth is buccal to the buccal cusp of the upper teeth. So this we describe as the buccal crossbite. Moving on to the other variation of the crossbite, that is called the lingual crossbite. Lingual crossbite is basically the reverse of the buccal crossbite. In the lingual crossbite, as I said, the lower arch is the reference arch. So lingual mean the lower arch is lingual as compared to the upper arch. Here, in simple word, if I say in the lingual crossbite, the lower teeth are lingual as compared to the normal relationship, or in other words, the lower teeth are lingual relative to the upper arch. In terms of the cuspal relationship of it, if I describe in another way, I can say like this: the buccal cusp of the lower teeth are palatal or lingual to the palatal cusp of the upper teeth. Okay, so the buccal cusp of the lower teeth are lingual to the palatal cusp of the upper teeth. This we describe as a lingual crossbite. This is also known as a scissor bite as well. So moving on, the lingual crossbite could be could be involving one or two teeth, and if they are involving one or two teeth, this could be due to the early loss of the deciduous teeth. If there is an early loss of the deciduous teeth, the posterior teeth may come forward and push the teeth lingually. So that will be creating a lingual cross, as you can see over there. You see there could be an early loss of the E, and the molar has moved nasally, and there is no space left for the eruption. Proper space is left for the eruption of the five. So hence this has moved into the lingual relationship. So this is making a lingual crossbite, and this could be this lingual crossbite. If one or two teeth are involved, that could be due to the as a result of the crowding or the retention of the deciduous teeth. There is a possibility that if the deciduous teeth is retained over this, then this may deflect the eruption of that particular tooth into the lingual position, leading to the lingual crossbite. However, if the whole segment of the jaw is involved, in the last case, as you can see over there, only one tooth is involved. If the one tooth is involved, this could be a local cause. However, if so many teeth are involved and the whole of the buccal segment is involved, then this could be due to the underlying transfer discrepancy. Okay, as you can see, either the maxilla is wide or the mandible is so narrow in the transverse plane that this was leading to the lingual crossbite of the whole segment. Moving on, this could be also due to the transverse discrepancy, and this could be also due to the abnormality in the anteroposterior plane as well. If the mandible is too much short in the anteroposterior plane, the lower jaw as such would be too much posteriorly as compared to the upper teeth, that would be leading to the lingual crossbite. Displacement is a kind of a situation in which the mandible move from the rest position to the maximal intercuspation. So during the movement from the rest position toward the maximal intercuspation, there could be a possibility that there could be a dental interference. It could be the anteriorly or posteriorly. So at the point of the dental interference, in order to avoid the dental interface, the mandible may move anteriorly, posteriorly, or laterally in any direction, left or right, in order to achieve the maximal intercuspation. As you can see in this photograph, the mandible is moving from the rest position, and at the point of the centric relation, where there could be an abnormal tooth contact. So in order to avoid the dental interference and abnormal tooth contact, the mandible may move in any direction, anteriorly, posteriorly, or laterally, in order to achieve the maximal intercuspation. So this movement of the mandible in order to achieve the maximal intercuspation from the point of the rest position to achieve the maximum bite and intercuspation, this is called displacement, and this displacement could be a reason for the abnormality and discrepancy in the transverse relation of the posterior or anterior teeth, leading to the development of the crossbite. So there could be a unilateral crossbite as well. Unilateral crossbite means on the one side of the jaw is absolutely and perfectly normal, and there is discrepancy in the transverse relationship of the teeth on the one side of the jaw. So as we are aware of the displacement, displacement is what the movement of the mandible in order to achieve the maximal intercuspation. So if the maxilla is symmetrically short, if the transverse plane of the maxilla is symmetrically short, then you would be observing cuspal interference on the buccal cusp. If you can see the photograph very carefully, you could see there is a contact on the buccal cusp here and here. The buccal cusp of the upper teeth are touching to the buccal cusp of the lower teeth. The buccal cusp of the upper teeth here again are touching to the buccal cusp of the lower teeth. So this is not the maximal intercuspation. So the patient may deviate his mandible on left or right side in order to achieve the maximal intercuspation, leading to the development of the unilateral crossbite. So how does the unilateral crossbite would affect? Patient is not having the maximal intercuspation, so it is moving his jaw to one side. Here now you can see the posterior segment is has developed a normal relationship in the transverse plane, and there you can see the buccal crossbite. So this would lead to the development of the unilateral crossbite, and the cause of this unilateral crossbite is symmetrically deficient maxilla, because the buccal cusp of the upper and lower teeth are touching in one plane. So in order to achieve the maximal intercuspation, the mandible has moved left or right side in order to develop the normal relationship on the one side, leading toward the development of the crossbite on one side. You can see that the mandible has contact over there, and in order to achieve the maxillary intercuspation, you would have developed a normal transverse relationship on this side. You can see this is the normal relationship after the red line is after the deviation of the mandible. So the mandible has moved toward the one side, leading to the normal relationship on this side, and there is a buccal crossbite on the other side of the mandible. This is unilateral crossbite due to the deviation of the mandible. As you can see in this photograph as well, on the abnormal transverse relationship, there is a symmetrical center line. Okay, after having the normal relationship on this side, you can see the midline has shifted a lot. Here is the center line and there is a center line. Obviously the mandible has deviated to this side, so leading to the buccal crossbite on this side and the normal relationship on this side. There could be another possibility in which there is a unilateral crossbite without the deviation of the mandible. Without the deviation of the mandible means that the mandible has moved from the rest position toward the maximal intercuspation, and there is no such point where there could be any dental interference. This could be due to a dental region in which one or two teeth have erupted in some abnormal relationship and has erupted into the crossbite. However, if the maxilla is asymmetric, for example, I can say okay, this side of the maxilla is not very efficiently and appropriately developed. So because of the skeletal asymmetry, this could be due to the constriction in the maxilla. This could, and there is a possibility that the mandible could be enlarged skeletally on this side. If there is a whole buccal segment is involved, then we can say this could be of a skeletal origin, or if one or two teeth are involved, then this could be because of a dental origin. So the other variation of unilateral buccal crossbite is without the displacement of the mandible. So let's summarize. We have a buccal crossbite of two types. One is the buccal crossbite with the deviation of the mandible that we call as the unilateral buccal crossbite with displacement. This could be due to dental interference, that could be anteriorly or posterior dental interference, and in order to avoid that dental interference, the mandible moves toward the one side, so that way it achieve a kind of a normal relationship on the one side, and there is an abnormality in the transverse relationship on the one side. And the other variant of the uh, unilateral crossbite is without a displacement, and this could be due to the eruption of one or two teeth in the crossbite relationship, or there could be a problem and abnormality in the skeletal basis. The maxilla could be asymmetric and the mandible could be asymmetrically wide, and here in the without displacement, the mandible move from the rest position toward the maximal intercrispation without any dental interference and without the deviation of the mandibular jaw in any direction.